Well, let me ask you a question. Does your face keep smiling even after you've stopped? Do you see deep lines that just won't go away? Well, Dr. Patti Flint is a board-certified plastic surgeon and has a solution that requires just an hour in her office. Say no more. I love this idea. First of all, Dr. Flint, we're talking about a couple of different treatments that you do, one of them being BOTOX. And I don't think a lot of people really understand what BOTOX does.
You're right. There's a lot of confusion out there about non-invasive treatments, and there's so much to offer in this era. I'm happy to be able to provide these non-invasive treatments.
So what does BOTOX do?
BOTOX specifically blocks signals from nerves to muscles. So when we animate our face, the muscles contract, creating wrinkling. So if we can soften the muscular contraction, we decrease wrinkling.
All right. Matter of fact, we're taking a look at this one right here, and that's where we're seeing like the lines up in her forehead, and she's making that expression in the before, and she's making the same expression in the after, but you can't see those lines.
Less wrinkling for certain, and I think my goal is to finesse BOTOX so that you can still animate your face, you can still smile, laugh, raise your eyebrows, look surprised if you need to, but with less forcefulness so there's less wrinkling.
And I think that's what scares a lot of people, because they hear about, oh my gosh, it's going to block something and I'm not going to be able to move. They don't want to have a stone face. I mean, look at this gentleman right here, which, by the way, BOTOX is great for guys as well.
BOTOX, we call it these days.
I like that. I like that.
He has a wonderful result. He was concerned that clients were thinking he was looking worried or angry when he wasn't. And so we just softened the degree of contraction of the muscles, and he looks much more relaxed and open.
Wow, he sure does. Look at that right there. And those lines, what do you call those lines right in between the eyebrows?
We call them the 11s, or the frown worry lines. And in his case, his lines were quite deep, and so I used filler in addition to BOTOX to completely smooth the lines between his eyebrows, and he got a beautiful result.
Oh, okay, so you can do both.
Absolutely, in certain indications, and it really requires an examination by a board-certified plastic surgeon to determine which product, in what amount, in what area is going to give you the nicest result.
And if you're really a good candidate, right?
Exactly right.
All right, let's talk about fillers then, something completely different. He was a combo of BOTOX and fillers, so what do fillers do?
Fillers actually do exactly what they say. They fill up deep furrows, and particularly in areas around the mouth where we really don't want to blunt muscular movement like BOTOX would, because you want to be able to smile and speak. We use filler more commonly in those areas.
Wow.
And this gal actually had some fairly deep parentheses lines, which are the lines between the nose and the corner of the mouth, and we were able to soften those very dramatically with the use of filler in her case.
Oh, it doesn't even look like the same person. Wow, she looks a lot younger, too.
A lot younger, and a lot more relaxed and content.
And how long would a filler actually last? Does it depend on the person?
No, that's a great question. I think it depends on the type of filler used. There are multiple different types. I prefer more natural products that are native to your system, and we usually only find ourselves re-injecting about once a year.
Really? Does it hurt?
Not particularly. We use topical numbing medicine, just a cream that goes on, and some ice. And patients are really in and out of the office within about 30 minutes with minimal to no downtime.
And you know, our faces are so very important. We've talked about how little things can really age us out, but you do a variety of treatments. Besides the BOTOX and the fillers, you also do peels and other types of treatments that can lessen the signs of aging.
Absolutely. I think an integrative approach really provides the most complete and the most natural results. So skincare, peels, and injectables really work in concert with potential surgery to create the most natural results.
Absolutely. Well, in your skin, you know, you've only got one face. You got to take care of it, just like your teeth, right? You got to take care of it. It's never too late to start. All right, well, here's what Dr. Flint is offering you, our Sonoran Living Live viewer. If you mention Sonoran Living Live when you schedule your consultation, you'll receive $100 credit towards the same day treatment. Dr. Flint's located in 2 different areas of the Valley, one in Old Town Scottsdale and the other one in Mesa. To make an appointment at a location near you, you can call 480-945-3300 or log on to pattiflintmd.com.